Hi, I'm Doug Sutherland. I'm a board-certified urologist. I've been practicing in Tacoma, Washington for the past 10 years. I specialize in urologic oncology, but as any urologist will tell you, I spend a substantial amount of time talking about men's health. So today we're going to be coming to you from Rainier Medical Health and Fitness, which is a gym and medical practice that I co-own with my wife and medical director, Valerie Sutherland. And we're hoping that it will entice more men to find time to get out of their day-to-day schedule and spend a little bit of extra time focusing on their health. So the first question that I received today were, what are the top 3 health issues that men should be thinking more about and should be talking to their healthcare provider about? Well, number 1 still should be, first and foremost, cardiovascular health. Cardiovascular health and cardiovascular events like heart attacks and strokes are still the number 1 health issue that we see taking men out of their A game more often than any other condition. So certainly cardiovascular metrics such as blood pressure, their cholesterol, this is critical. This is mission number 1. It's what we should mostly be focused on as men. Number 2 is going to be their metabolic health. Metabolic health is a fancy medical term for obesity or being overweight, excess fat disease. And that's really an overall condition that leads to most of the cardiovascular deaths that occur in this country. There's also a massive amount of research suggesting that metabolic health impacts all other aspects of our health, including our predisposition to cancer, but the thing that gets most men into the doctor's office in the first place is the ability to have sex, and erectile dysfunction in general. And the third most common issue that men should be thinking about and talking to the doctor about is orthopedic injuries and their overall ability to be functional. So as men age, get into their 30s, 40s, and 50s, as an old mentor of mine once said, our sphere of ability and capability decreases over time. And by far, this is one of the most common complaints that we get in the offices amongst our patients. How can I do weightlifting? Or how can I get back on the basketball court? I really want to ski. How can I get back on the skis? By far, the most difficult thing about taking care of men as a physician is just getting them into the office. Men generally don't come in to see the doctor unless there has been some specific event. And you'll look at their labs, you'll look at their records, and you'll say, man, you've been having trouble for 5-10 years. Where have you been? It's our assumption that if we exercise once or twice a week, or if we watch our diet 1 or 2 meals per week, that things are going okay. If it doesn't hurt, if I don't have any difficulty, that means that I'm okay. Men assume that if they have a low testosterone, that's the primary reason why they have erectile dysfunction. In fact, it's quite the opposite. Most men who have erectile dysfunction have totally normal testosterone. One way that you can tell if there's a testosterone problem is in the desire for sex. Men will naturally lose their desire for sex. They simply will not have the same libido as they used to have as their testosterone levels drop. Erectile dysfunction can definitely happen if you have low testosterone. However, most of the time, the erectile dysfunction is happening because of metabolic changes in the body, often related to obesity, such as diabetes, hypertension, atherosclerosis, all the same stuff that happens when you have a heart attack or a stroke. It's not directly linked to low testosterone. I know there's numerous labs that will draw your testosterone pretty much just off the street for a small fee. But it's hard to put that number into perspective, and it's even harder to be able to translate your personal symptoms to your laboratory results. So maybe most important is that conversation that you have with your provider to decide whether or not it's appropriate to check that lab. But before you go in that direction, and before you make that very large and possibly costly decision, it makes sense to try to change your metrics and improve your parameters before you go to pharmacotherapy. There are a few things that every man who starts testosterone therapy needs to understand. Many men are worried that taking testosterone is going to cause prostate cancer, and there is a metric ton of data that suggests that's not the case. But it's known that if a man takes testosterone, it might make his prostate swell and he might have a hard time urinating. So you can usually predict that based on a man's incoming function. Another reason to have a conversation about that with your provider. And the last thing to discuss and to consider is the cost. Testosterone therapy is an ongoing therapy. It's not like antibiotics where you take it for 10 days and you're back to normal. Another reason to consider trying to fix your testosterone numbers, metrics, and values using diet and exercise techniques before you go straight to pharmacotherapy. So it certainly was not my intention to make any of this sound overly complicated and to add too many variables to your list of things to worry about. What I'm trying to do is I'm trying to build a case for having a coach, having a provider, somebody who you can meet with and trust and have that relationship with to go through all of these various clinical indexes. The Executive Wellness Physical Program, what it aims to do is to give you guidance. So for example, we might intake somebody, go through their metabolic health, find that they have very specific obesity related parameters, and then literally translate that from the clinic over to the gym in a very effective, very efficient use of your time. Right behind this camera, there's actually a physical exam room and an entire office aimed at condensing your medical appointment inside of a gym so that you can do both at the same visit. It's important to say that if you have low testosterone, you probably are going to be a candidate for testosterone replacement therapy. But it's equally important to say that it's not right for all men. And there are both pharmacologic ways to fix this, meaning I can give you drugs or I can give you injections, for example, to fix your testosterone. But there's also more naturopathic ways to improve your testosterone parameters, including changing your diet, exercising differently or less. So there's many things that we can figure out in terms of what you're doing, what you're eating, and how you're living that might improve your testosterone parameters that do not include an injection or a cream.